Yeah, I don't see it.
Well, I have a split personality. I have a T representation and a actual living representation.
Okay, so it just started recording and we can get started. So I'm gonna start by giving you guys a basic intro, and then you guys are gonna have a couple of minutes to introduce yourselves. So today we have Tom Wells, who is a progressive Democrat running for Florida's District 3. He's a scientist and is in favor of policies such as Medicare for all and a Green New Deal. And we also have Dr. Schuester. Dr. Schuester is a world-renowned master of medical statistics and epidemiology. So you guys can introduce yourself. That'll be fun.
John, you take precedence. You're at least a couple of days older than I am.
Yeah. Well, I had a 47-year career at the University of Florida, the College of Medicine, from starting in 1969. Came from McGill University in Montreal. Got my PhD there, and I've been a biostatistician and epidemiologist for almost all my career, and I've worked in, my main accomplishment is a 20-year stint founding group statistician, a pediatric oncology group. I worked in childhood cancer, but in the meanwhile, I did a lot of work with NIH, the National Institutes of Health. I spent 15 years on grant review committees in epidemiology, and many major projects went through our committee. And I'm not a politician, but I'm very interested in politics, and I'm a real, I think, a big fan of Tom's in terms of climate control. I've learned a lot about it, and some from Tom, but I know I think that's the winning, in my view, thing for Tom is to make sure that environment and climate change are the number one priorities. And I've written about 400 peer review articles. I've had over $30 million as principal investigator on federal grants. And I've done a lot of peer reviews of other people's work. But I really think that this is Tom's year, and I think we have to get him over the top, and anything we can do to do that is fair game, as far as I'm concerned.
Well, John, that's very gracious. I will mirror you in mentioning my resume briefly. For some reason, people thought I was kind of bright in high school, so they let me into Caltech, and I found out what really bright people are like. Went ahead and went to graduate school at the University of Maryland and finished a PhD in theoretical physics, and having a child on the way, I went immediately to pretending to be an electrical engineer and working at Georgia Tech, and did that 15 years at Georgia Tech before going into small businesses. And I found that there was just as much bureaucracy in small businesses as at Georgia Tech. So I finally, 2005, set up my own small business, and I've been 15 years out without declaring bankruptcy a single time. The last 5 years, I've been a devotee of progressive politics. I had spoken of it with my children to the extent that they were really happy that I started speaking to a wider audience. And of course, Bernie Sanders created the environment in which it was possible to speak of all those things which should have been being spoken of for the previous 40 years. And I entered the contest for US CD3 in 2016 as a practice round, as no political association. And it was educational. I learned that I am at the right level to be running for Congress and to affect major changes when I get there. And in 4 years of doing the physicist thing and stepping back and looking at the larger problems, have attained some clarity as to how to do the things which we all know need to be done. So in January of this year, I was well aware of the coronavirus in China, but I was also well aware of the team in the US which had controlled Ebola in Africa and only had 2 deaths in America. Those were all people who had both, well, there was one tourist who was there, brought it back, but did not spread it because they had logistics, they had planning, they took care of it. And when they brought people who had been working in Africa back, they had logistics, they had planning, and they controlled it. I thought those same institutions were in effect as we started 2020, and obviously when they were not. The Trump administration is anti-intellectual. Trump himself cannot visualize that anyone knows anything that he does not know. And there's a vast amount that he does not know. So we cannot solve the problems we have now. Go ahead.
I was just saying you're fading in and out a bit, but you're absolutely right that the next several years are the tipping point, and lots of bad things can happen if we don't put this as our #1 priority, including the permafrost. Tom and I have talked about this before, but this year, I understand this year they had a 67-degree temperature in Siberia, northern Siberia, unheard of. And the permafrost is just waiting to be not permafrost, and all the greenhouse gases that are trapped.
Well, there's an anomaly, which is that while the world average temperature increase from pre-industrial eras is in the 1 to 1.2 range centigrade, in Siberia and the Arctic Ocean, it's 7 or 8 degrees above the pre-industrial average, and permafrost is melting. And the problem with that is that this is not just we're the problem kind of thing. We're the problem, and the planet has resources that we do not want to see. It has 700 gigatons of trapped methane beneath the floor of the Arctic Ocean. The thinning permafrost there threatens to let that release. And at that point, it will not matter if we have stopped using fossil fuels, because the heating potential of that is enough to throw us well into the climate chaos and the collapse of modern civilization. So.
Okay, so I'm going to jump in really quick here. Today we're here to talk about Medicare for All and the coronavirus pandemic. So we're going to start with the pandemic portion of the discussion. Our first question is from...
They are connected.
Yeah. So our first question is from an intern on the campaign. With many states losing coronavirus restrictions as the number of cases go up, such as in Florida, is it safe for states to start reopening?
John, I'll give you the first shot at that.
All right. No, it is the economy, though. The economy is going to suffer, and we lost our opportunity to beat this thing the way Europe has beaten it, which Europe was considered, the evil, but Europe has done pretty well of late. But we do have to socially distance, and just the numbers are coming way down in Europe. Like they're getting, I think, 5,000 new cases a day, when they were getting 40,000 cases, and we're still getting something of the order of 30,000 new cases a day. So the numbers for us, we have numbers that are per capita are comparable to Europe, but they won't be for long. We're going to
No, the
vastly
problem
surpass them. And
that
the thing is, we've got to socially distance, as painful as it is, especially in the hot zones, which there are, more than half the country are hot zones now. So that's what I think we have to. We have to be very vigilant. It was a disaster what happened over Memorial Day weekend and from the protests, which are legitimate, but they're going to cause a lot of disease.
well, the real disaster was that Europe, when they went to lockdown, countries like Germany in particular, but to varying degrees, all the European countries used tracking and containment to separate the populations who are carriers from those who are not carriers. And at that time, in March and April, we were still largely in denial that asymptomatic transmission was a fact. It was known in January in China. We just don't have a government that is responsive to proven knowledge. And the people who surround the president are understating dangers, because if they state them accurately, they'll be fired and replaced by people who are more pawns of ignorance. And we will not pull out of this until we have a new president and new administration top to bottom, because this is an administration largely of white incompetence and intransigence. People who are appointed to head a department because they are opposed to the ground laws which they are sworn to enforce. So they're destroying the fabric of our society, which is most evident right now in the pandemic.
And he has, our leader has a habit. There was only one person really complimenting her. Everyone else who compliments him is complimented because he insists on being complimented. So I think it is pretty hopeless under this president. The pandemic can be contained. The idea of opening things up so quickly, even in the fact that the Fauci and Birx set up rules which were overly generous to opening, and when they didn't fulfill the criteria, they, instead of backing up, they made it even more open. Yeah. So almost nobody fulfilled the phase 1 criteria to move into phase 1.
So even the best epidemiologists who are allowed to get on TV and who work with Trump understate the problem. There was a claim by Trump at his rally that he was cutting back on testing because then it wouldn't exist if you didn't count the cases.
They already undercount.
Oh yeah.
There's vast undercount. The death certificates are essentially forgeries, a lot of them. You can't put COVID-19 as a contributing cause of death on death certificates, especially in Florida, but in other states too.
Yes.
Okay, so really quick, we're going to move on to the next question. The next question is specifically for Dr. Wells, but Dr. Schuester, you can also weigh in. Tom, as a congressman, what will you do to help mitigate the effects of the coronavirus and improve the national response protocol to pandemics?
What was the last word?
Improve the national response protocol to pandemics.
Oh, pandemics, yes, of course. Well, the response is trivial in that the answer is well known. We destroyed the pandemic response team in 2017. Trump fired them all because he didn't want to waste money on something that was not an immediate threat. So the skill set exists here. We did everything wrong. He claimed to do one thing which would have been perfect, which was to cut off travel from Wuhan and from China. But they brought people back before they had any tests. And they brought them out without any training in the use of personal protective equipment and without any effective quarantine measures. And they introduced by themselves broaching the border security, which Trump brags about in preventing people from coming to pick our food and help us with our agricultural work and for their children to grow up and be doctors. We've protected ourselves from that wonderful thing and admitted this horrific pandemic. What will we do in Congress? We will do what epidemiologists always do. We will track and contain. But we're at a point now with 2 million known cases and probably 10 million actual cases, where tracking and containment would require a staff of 50 million people to do it correctly. So we have to adapt a different strategy. And John, I've been giving this some thought. We haven't talked about it, but I would really value your reaction. I think we should use the National Guard, train them in the protocols for performing tests, go across the country, 330 million tests in a week by careful pre-planning, move people who are positive into quarantine, make sure they're taken care of, let the rest of the population come out and work. And we can then cleanly achieve the separation between those infected and those who are not at risk. And we can reopen the economy potentially in 2 weeks. We had a 2-month closure. We did nothing during that time. We cost $5 trillion in interest-free loans, gifts to the companies who are not hiring, not keeping on the employees, who are devastating the country while they're buying new yachts. If we had spent that money on the general population, guaranteeing continued salary for the businesses that are closed, the ability to pay rent, then we would not have the economic malaise that we face now. And we know that because that's what the countries in Europe did, and their economies are suffering much less than ours. And ours will suffer a lot more before this is over because of the preconditions we set up. John, what do you think of that National Guard strategy?
I totally agree that everybody needs to be tested, and the National Guard can do it, and volunteers train people, and we have a lot of intelligent people who are now unfortunately idle. Yes. And I'm sure that the national sentiment would be to have a volunteer army, if you call it, to go out and get everyone tested, and the information can be tracked. Anyone who's positive, quarantine, as you say, and then we can also do a retest at some point, somewhat later. And not only that, we should find out about those who have antibodies. The testing, we should be testing and antibodies, and we see what happens with the antibodies, because the next wave that's coming, and it seems to be heading our way, another wave, it's important to know what the status is, because I've been hearing mixed messages that some people have gotten infection more than once. And was it a bad test, some relatively asymptomatic people, or was it a real second infection?
Well, now there were reports in Korea of people testing positive, retesting positive after being cured. And I think all those cases in Korea were tracked down, and they found that the people who tested positive, their antibodies had actually destroyed the virus's ability to replicate. And what you were testing positive on was non-contagious bits of DNA. So that is a tremendous relief. Still open to the question of how long the antibody resistance will be effective. So given that is a very positive result. Presumably it's not specific to the variant of the virus that you're encountering, but nonetheless, to go for herd immunity, which is what we're doing until we have a national program, will risk 1 million deaths and also the possibility of antibody depletion and re-going through the whole cycle. The 1 million deaths is horrific, but the number of people who will suffer major organ damage, permanent organ damage, It's vastly larger. We are at risk of a whole population being at larger risk to all sorts of major diseases that cannot even be cataloged yet. So the demand for action has never been larger. This is the greatest national security failure in our country's history, greater than, will in the next 6 months be greater than the combined total of all national security failures and successes. World War II, we lost 200,000 men, but we won the war. We're getting towards 200,000 people in this pandemic.
Okay, so now we're gonna move on to our healthcare and Medicare for all part of the town hall. So our first question is also from another intern. Tom, you believe that healthcare is a human right. So I want to give you a chance to explain your views on establishing a Medicare for all plan and what you mean by for all in Medicare for all.
Well, thank you. Yes, just like a minimum wage carries the implicit meaning of minimum wage, like it would apply to wait staff and farm workers and babysitters. It means it applies to everyone. So Medicare for all, I've seen people who say, well, it should only apply to legal immigrants, people with papers. No, Medicare for all means that if you have a tourist in America, and I've been a tourist in Europe and received treatment for free, the same should apply reciprocally for tourists here. For people who are illegal aliens and who are working and creating wealth for the people who employ them, of course, they are humans. It is a human right. It is not a citizen right. And the fact is that it's actually cheaper to treat people than to figure out how much to pay, to charge them, and how to collect it. And the collecting from people who have nothing is a fool's errand. Now, you did ask about implementation too, and right now, something like 48 to 60,000 people a year die due to lack of access to health care. A plan in which you implement Medicare for all 2, 3, 4 years of incremental reductions in the Medicare access age is unjust. It is unjust to delay justice. So we will do it in 1 year. And I've actually worked with Dr. Joe Friedman, who has proposed 1-year plans and done the calculations, done the analysis, actually written the bills to accomplish this in New York and a few other states. It's actually easier to do it nationally than in a single state because you have control over immigration quotas. You can admit more doctors, nurses, physical therapists as you need them. You have a lot more control over the structures of Medicare and Medicaid that are being used to pay for it. It is actually easier. Dr. Friedman has agreed that for a very modest, a few $1,000s, he will produce a detailed analysis of that transition. I'm hoping by things like this to publicize that possibility, because it's always nice to have paper on the table, a real plan laid out.
Okay, Dr. Schuester, do you have anything to comment on that?
Yeah, healthcare is an absolute right, and having come from Canada where they have a universal healthcare, it's a province by province thing. The actual fact is that basically Medicare, as it exists, is very good for the people who are on Medicare, and I don't see any reason why it can't be scaled up. And there are going to be a lot of savings, it can be done in other countries at half the cost that it's done in the United States. The stranglehold of pharma, of hospitals that have to make a lot of profit. I mean, they're going to have to pony up, and we're going to have to take profits out of the the amount of money there is right now, which is being paid for medical care, is 10, and this I looked at a couple of years ago, $10,000 a person. Most Western countries, it's around 5 or 6. So the money is there, it's just misspent, misallocated, greed, and so on. And I know Tom has a lot to say about that, but this is the greed of the medical industry in general.
Well,
Okay.
the greed is only effective because the Congress passes laws that affect that greed. For instance, Medicare Part D 2004, the law has a phrase in it, a paragraph which says effectively, to the Medicare administration, thou shalt not negotiate drug prices. So when the patent holder for the EpiPen raises the price of EpiPens from $6 to $600, everybody else in the world pays $6 still, and American Medicare pays $600. It is an irrational vote. Nobody was punished for it because the people who publish the papers are also part of the same corporations that are profiting from this horror. That is worth about $100 billion a year, that single notation in a bill 16 years ago.
Okay, so that's a great transition into our next question, which is on Big Pharma. Our next question is on Big Pharma. People want to know your plan for taking down big pharma companies and lowering the price of prescription drugs through progressive policy.
Well, you will simply go through the legal registry. You will eliminate the, I think it's 1981 NIH law, which said that any patentable discovery by NIH would be transferred to a company which probably had next to no involvement in the development. And in general, drug testing is paid for, if not the actual development of the drug, the companies are very careful to pay for the testing of the drug. And when they control the testing, they usually get the result they want. Every kind of testing of things that are going to be sold to the public should be done at government expense. And that expense comes from taxing the companies that are going to benefit. So letting a company pay $100 million for testing a drug and getting you a wrong result, like the opioid addiction crisis came from such a poor result, and the regulatory capture of the FDA, so that two of the 5 voting members on the FDA that decided that the opioid prescription was non-addictive were lobbyists for the company that was producing it, and the third got bought. And the result has been an epidemic that puts to shame the heroin and cocaine drug cartels. Our biggest drug cartel has been legal. And that is insane. There are many aspects of this. I do not know them all. I've named 2 bills, but we will go back through the registry of patent laws, patent law variants, handling of generic drug companies. And if we have people on our side, if we have a representative government, if we have public funding of elections, then this can be done. If it is, those things are not true, it cannot be done.
Okay.
I have a couple of things to add to that.
Yeah.
First of all, that there are some of the biggest scoundrels in the world work for drug companies, and when they get caught, it's civil. These people should be in jail. The law should be written that you do something that is as wretched as some of these people are doing, you will go to jail. You're not going to have your company bail you out for umpteen, even billions of dollars, when there's hundreds of billions of dollars that are being built, and people suffering for it, and they don't consider the cost of the suffering that people undergo because of that. So we need to have very strong laws. We need to have some compromises with pharmaceuticals, such as that if the patents, they get a 17-year patent on a drug, and release product or something like that, they get another bunch of years tacked on. Patents should be weakened after a certain number of years. But when the generics come out and pay, they should pay a fraction to the drug company that developed it. And again, if the government developed it, then the government should have the big stake in the ownership, and the price should be determined by the government for the prices, and they should be similar to Europe and other countries. They want to make all their profit in the United States and give it away in Europe.
Well, an example is the hepatitis C drug, which was developed largely under government programs, and which in the United States sells for a course of treatment, sells for about $100,000. In India, it's still substantial by an Indian budget, but I think the price is around $80. And the reason that India can do that is that the Supreme Court in India ruled that the drug patent was illegal because the drug company holding the patent had not developed the drug. So our laws are not recognized as having any weight in other countries because they're so extremely corrupt. There's no other way to say it.
Okay, so our last question circles back to Medicare for All. One of the most prevalent arguments against a Medicare for All plan is that it would be impossible to pay for. So Dr. Wells, what is your plan to pay for Medicare for All?
Well, we'll just take the $1 trillion refund that we get and say pay off student loans the first year. It pays for itself. Everybody now knows this. I started arguing 4 years ago that you compare apples to apples. Other countries, the highest price 2 or 3 years ago of any other country was $7,500 per year per person, $10,500 per year per person. So we know that we can save $1 trillion per year. Now, the research that Dr. Gerald Friedman has done has shown that savings by detailed analysis. So it's not a question of paying for it. You have a bit of rearrangement because a lot of the costs right now, more than $1 trillion, is borne by individual payers. So there's several $100 billion of additional taxes that are needed to eliminate all payments by private citizens, other than just normally paying your taxes. And that $600 billion can easily be obtained by raising tax rates back up to a rational progressive tax rate. Now, one of the questions that I get frequently from people who are thinking about this, who are familiar with the system, is there are 1.5 million code matchers in the pharmaceutical, in the health insurance business, and a similar number in the hospitals. And they spend their lives fighting over how to code a procedure that was done to a patient so that it will be in the plan or out of the plan, or the hospital can get a maximum amount of money. A very morally abusive kind of work to be destroying people's chances at health for the profit of one or the other entity. Those 3 million people are not doing it by choice, but because they have very little alternative employments. They have good skill sets. They know how to read contracts. They know how to do detailed work. They average about $30,000 a year. That's $90 billion a year that can be saved. But we will spend that $90 billion the first 3 years, giving them full salary and access to free tuition, public education, which everybody will have free tuition, but they need to continue as well having the salary to maintain their family as they learn a new profession. And that during that 3 years, I would make use of them also to look at the history of all the what is it, 75 million extant student loans, because I suspect that those loans have been used in a predatory fashion and the banks cannot document what they claim students owe, and we will abuse the banks a little bit by not giving them unearned profits. I'm sorry, that's kind of rational as opposed to abusive. What they are doing is abusive. We will end the predation of non-dischargeable student loans with variable interest rates and penalty functions, which are incredible, and where when the student dies, his parents have to pay off the loan. These are insanities, even compared to abusive credit cardship.
Well, here's something. How can the current system be cheaper than Medicare for all? Saving money, what is it? There's demand for health care. That demand should be met, whatever system you have. So the only way, and since there's so much profit that's in the current system, it means that healthcare is being denied in unbelievable amounts and people are suffering for it. So if you have a system that covers everybody in a fair way and another system that might seem cheaper than denied the health care that they really need are the ones who are suffering, and it's costly. It's more costly. It has logically giving health care to every person is cheaper than the current system.
Okay, thank you both for your thoughts. We have one very last question from another intern. Let me get it real quick. Yes. How would a Medicare for All system affect medical research?
You want to dive in on that, John?
Yeah, I can say favorably, very favorably. And the reason is that you will have a common system, record system. Once you get a common record system, you can look at a lot of interesting questions. And one example I'll give you is generic drugs. That you can, if perfectly legal and perfectly ethical, suppose that a generic drug is given for something and there's been a brand name drug. You can give 10% of them or 5% of them, because they're giving lots of them out, give them the brand name drug without telling them. And that's good. If anyone has asked that, they say, I want the brand name drug. So it's not unethical not to tell them. And then you look at what happens with it. And a good example of this happened in Saskatchewan, Canada, where they discovered that one asthma generic was killing people, but they were small, it's small numbers, but it was very significant. So if your child has asthma, it'd be very interesting to know. And that asthma drug was withdrawn, that asthma generic was withdrawn. And it was only found through having good medical records. So you'll be able to know a lot more. A lot of the Scandinavian countries do research. They get bloods from birth. Every child's a blood sample. They do genetics on it. And then they can look later on and say, okay, what are the genomes that go with someone developing diabetes by the age of 30? They have eons of records. They can look at those at questions like this. So Medicare for All is going to mean common medical records. It's going to be a boon for medical research.
John, am I correct in thinking that there's been a lot of prejudice in the populations that were used in testing drugs to exclude women or pregnant women or people of color?
I can tell you about women because I don't know if you know the name Carl Pepin, who's a friend of mine, and he's a cardiologist who studies women's heart disease. And they have had until they recently had to go to the Defense Department to get a grant, but they had a really tough time to zero in on strategies specific to women in heart disease. So yes, there is a tough time. Women and minorities are underrepresented in research, and that's just another one of our big racial divides that's covered in this country.
Yeah, so many problems and so deep.
women are still treated basically in the mainstream healthcare system as men, and their heart disease has been shown to be very different in etiology from men's.
Wow. Good example. Thank you.
We're going to get these massively blocked arteries.
Okay, thank you so much for your thoughts,
Sure.
Dr. Schuster.
Interesting.
Dr. Wells. That will be the end of the town hall so far. I really liked your answers. It was a great time to talk to both of you, get your views on Medicare for All and what we should do during the coronavirus pandemic.
Who are the interns? Who are the interns?
The interns? Yeah, one of them was Thomas. Let me try to find his last name.
You have to tell the name, but just what.
Yeah, let me get his name right here.
You don't need their names. I just want to know what.
Oh yeah.
General.
Yeah, interns for the campaign.
Okay.
Yeah. So.
Very good.
I'm gonna end the recording right here.
Another intern.